My name is Dr. Ronald Nelson. I go by Junior, and we'll be talking today about psoriasis. The title is Psoriasis, a Clear Conversation. This is a talk about psoriasis. It's sponsored by Abbott, the pharmaceutical company that makes Humira. And this is the disclosure that they are the sponsors of this event this evening. Abbott has been kind enough to sponsor this and provide us with our dinner this evening, as well as providing all the materials for this presentation. The purpose of this is to inform people about psoriasis and the disease state of psoriasis, what it is, and some of the treatment options that are available. And the most important thing for you as a patient to know is that you shouldn't necessarily take all the advice that I will be giving today, since you need to seek out your own doctor. I can't, write you prescriptions today. The purpose is to provide information that then you can take to your dermatologist or other healthcare provider so that you can be treated for your condition, for your psoriasis. We'll be talking about psoriasis and psoriatic arthritis. We'll talk about some of the different treatment options and then what other things you can do beyond some of the things that we can write prescriptions for. So, first we'll talk about psoriasis and psoriatic arthritis. First of all, who gets psoriasis? It's upwards of about 7.5 million people in the United States get psoriasis. So upwards of 2 to 3% of the population get psoriasis. It tends to occur equally in both men and women. There's not a predisposition to women or to men. It tends to be equal in both sexes. All races are affected. There's not one race that's more affected than others. And it tends to occur in patients of any age, but most commonly in patients between the ages of 15 and 35 is the most common time when people get psoriasis. So people can have it throughout their entire life. There are different types of psoriasis. There's plaque psoriasis. That tends to occur primarily on the knees and elbows. In some of these very, very common areas, sometimes up on the scalp. Again, very, very raised, inflamed, thick areas, red, irritated areas, and that have silvery scale on them. Guttate psoriasis occurs with smaller, almost like water-like droplets on the surface of the skin, usually on the trunk, back, and the legs. There's a condition called pustular psoriasis. This is much less common, but can be very serious, and this is the type that can put people in the hospital if they get the pustular psoriasis, pustular variant. About 80% of people will have that plaque psoriasis, the one on the top there. Inverse psoriasis tends to occur in the inverse areas. Unlike psoriasis, which usually plaque psoriasis occurs on the elbows, inverse psoriasis occurs under the arms, in the groin, under the breasts, in those type of areas. Nail psoriasis is also very common. That can occur with any of the types of psoriasis. And what people will have is pitting and discoloration, thickening of the nails. Can be very, very uncomfortable, particularly when you're putting your hands in your pockets and things like that. And then there's a type called erythrodermic psoriasis, which means you have psoriasis covering the entire body surface area. Okay? Again, very, very severe condition. Plaque psoriasis typically occurs on the scalp and the elbows and on the knees and on the body, or sometimes around the umbilicus, the belly button. And that's the most common type of psoriasis. So what causes psoriasis? What causes plaque psoriasis? Well, at this point, it's anybody's guess. There's lots of research ongoing, so it's not really known for sure what causes psoriasis. But what I can tell you today is that the current theories hold that the immune system plays a part. It's also thought to be genetically related, and that there's also environmental factors that play into it too. So to get this inflammatory process started, an individual person has to have the genetics that predispose them to psoriasis. And then there has to be some environmental trigger that causes the psoriasis to take place. Meaning that someone can have the genetic predisposition and never develop psoriasis. Okay, so That therefore means that it does tend to run in families, but not every family member who shares the same genetic background will have psoriasis, because that second factor, the environmental factor, that trigger may not have taken place. And some of the triggers, as you can see listed here, are stress, injuries to the skin, certain medications. There's even infections that can trigger psoriasis to come on someone's skin. So we've talked a little bit about psoriasis. Now, what is psoriatic arthritis? Psoriasis and psoriatic arthritis do go together. Psoriatic arthritis is a disease that manifests in pain in the joints, usually in the fingers, often in the toes of the feet. It can be very, very progressive and can lead to joint damage in somebody that has psoriasis. We call that psoriatic arthritis. Now, it is associated with psoriasis in that up to about 30% of people who have psoriasis also develop psoriatic arthritis. And about 85% of the people that have psoriatic arthritis had psoriasis to begin with. So consequently, the longer someone has psoriasis, the more likely they are to develop psoriatic arthritis. Usually the psoriasis precedes psoriatic arthritis, sometimes by up to 10 years before. So psoriasis is one of these things that's more than skin deep. It also affects the joints. There are many other things that psoriasis can affect. First of all, beyond just the way it looks, it affects how you would dress. It affects how that you would cover certain areas of your skin, as I'm sure you know. And you see someone wearing long sleeves on a hot summer day, trying to hide their psoriasis. That's something that can happen. Avoiding wearing black clothing because of the scalp psoriasis that would put flakes on the skin. Avoiding wearing black. These are the kind of things that affect people's lives in a visible way, and also in a deeply psychological way as well. It tends to make people depressed. There are many studies that show psoriasis makes people depressed. Gives them a lot of anxiety about interacting with other people, particularly in close personal relationships. So those are the kind of things that you need to tell your dermatologist about, tell your healthcare provider about with regards to treatment of your psoriasis, because this is, again, more than just a skin deep kind of problem. This also affects people psychologically as well as physically.